Hi everyone, my name is Anamika, and today I'll be presenting on telehealth as an interconnected healthcare system. Throughout this course, we looked at telehealth from several different perspectives, including providers, patients, policymakers, and technology or business leaders. So instead of thinking of telehealth as just a digital tool for virtual doctor visits, it's more accurate to think of it as a system where multiple groups interact and influence each other. So, in this presentation, I will be explaining how these four perspectives shape telehealth, why collaboration between them is important, and what the future of telehealth holds for them later in the later years. Okay, so when it comes to understanding telehealth, so it basically refers to the delivery of healthcare services using digital communication technologies. So this can include things like having your day-to-day video appointments between patients and providers, remote monitoring devices that track health data, and secure online messaging systems. So telehealth expanded very quickly during the COVID-19 pandemic when healthcare providers needed safe ways to treat patients without requiring in-person visits. So even after the pandemic, telehealth has continued to grow and it is becoming a more permanent part of healthcare systems. However, telehealth is not just about having the technology available. Its success also depends on how providers use it, so how patients experience it, what policies allow, and how businesses design these platforms. Okay, so now let's take a look at the four telehealth perspectives. So to understand how telehealth functions, it helps to look at the four key perspectives that come from providers, patients, policy, regulation, and technology and business. So let's start off with the providers. So this can include doctors, nurses, and other healthcare professionals who actually deliver care through telehealth services. Patients, who are the individuals accessing and experiencing virtual healthcare. The third one, which is policy and regulation. So this kind of includes government and how they rule, the government rules which determine the reimbursement, privacy protections, and the legal guidelines. And finally, for technology and business, this includes the companies and healthcare organizations that build and support telehealth platforms. So telehealth works at best as a whole when these four key perspectives are aligned together as a whole. So, coming from the provider perspective, so healthcare providers play a central role in implementing telehealth services. So, providers decide when telehealth visits are appropriate and how care should be delivered in a virtual environment. In many cases, providers have to adjust their clinical workflows and communication styles when working online with patients. They also have to make sure that the quality of care remains consistent with in person visits. Another important factor that affects provider adoption is the reimbursement policy. So, for example, if providers are not reimbursed for telehealth visits, they may be less likely to offer them. And another example is that during the COVID-19 pandemic, expanded Medicare reimbursement policies did lead to a significant, massive increase in telehealth use among healthcare providers and patients. And as you can see on the right here is a chart to see how the use of telehealth has increased ever since the COVID-19 pandemic. So now let's take a look at the patient perspective. So telehealth can provide several important benefits from this aspect. So many patients appreciate the convenience of being able to attend healthcare appointments from home. Telehealth can reduce travel time and transportation barriers, which can make it easier for people to access healthcare, and it can also make scheduling appointments more flexible. However, telehealth also does have some challenges. Some patients may not have reliable internet access or the devices needed to connect to virtual visits. Others may struggle with digital literacy or feel unsure about using online healthcare platforms. So, because of these challenges, healthcare systems do need to focus on improving accessibility and making sure telehealth services are available to diverse patient populations. So, government policies and regulations also play a major role in shaping telehealth systems. So, policies do determine whether providers can be reimbursed for telehealth services and whether they are allowed to practice across state lines through telehealth platforms. So, regulations also establish privacy protections that ensure patient health information. They have to make sure that it remains secure for the long run. And for an example, telehealth platforms, they also are required to follow the HIPAA guidelines in order to protect patient data. Clear and consistent policies do help create stability within telehealth and encourage providers to adopt virtual care. As we saw during the pandemic, changes in reimbursement policies can significantly influence how widely telehealth is being used amongst providers and their patients. So, last but not least, for the technology and the business perspective. So, technology companies and healthcare organizations provide the infrastructure that allows telehealth to function. Telehealth platforms enable video visits, digital communication, and remote patient monitoring between providers and patients. These systems also need to integrate with electronic health records so that the providers can easily access and update patient information. And in addition to functionality, telehealth platforms must also be secure and user friendly so that patients and providers feel comfortable using them. And from a business perspective, telehealth systems also need sustainable financial models so that they can continue operating and improving over time. And when technology is well designed and integrated into healthcare systems, it can improve patient engagement and support long term care management. Okay, so one of the most important ideas from this course is that telehealth functions as an interconnected system. So the four perspectives that we've discussed earlier right now, which are providers, patients, policymakers, and technology leaders, they're all connected and they all influence each other. For example, policy decisions about reimbursement can affect whether providers adopt telehealth services. At the same time, technology design can influence how easy it is for patients to access care. Provider participation affects the quality and availability of telehealth services, while patient feedback can guide improvements in system design. Because these perspectives are interconnected, collaboration between sectors is essential for building sustainable telehealth systems. Now let's take a look at the future of telehealth. So looking ahead, telehealth is expected to continue playing a major role in healthcare delivery. One major opportunity is the development of hybrid care models that combine in-person visits with virtual appointments. So this approach allows patients to receive care in the format that best fits their needs. Telehealth can also improve chronic disease management by allowing providers to monitor patients remotely and maintain more consistent communication. And at the same time, there are still challenges that do need to be addressed. So this can include like the digital divide, which refers to having unequal access to the internet and technology, as well as ongoing concerns about data privacy and cybersecurity. And the future success of telehealth will depend on continued collaboration between the providers, patients, policymakers, and technology developers. And here are my references. Thank you so much for watching.